Hello everyone. This is the first video and introduction to this video series focusing on transjugular intrahepatic portosystemic shunts, or TIPS. The goal of this series is to provide an introduction and overview of the procedure, primarily focusing on the various tools and kits available and their different uses. In this first video, we are going to briefly go over the indications, contraindications, and important steps for the procedure. A TIPS, or transjugular intrahepatic portosystemic shunt, is placed with a percutaneous procedure commonly done by interventional radiologists, where an intrahepatic stent is placed between the hepatic and portal veins, bridging the systemic and portal venous systems. The procedure is minimally invasive and commonly done with the patient under general anesthesia. The procedure carries an associated mortality of less than 1% and a complication rate of less than 5%. However, the success of the procedure is largely based on the experience and the skill of the physician performing it. The primary indication for placing a TIPS is symptomatic portal hypertension. In most cases, this is an elective procedure. However, there is the possibility for emergent TIPS procedures in certain circumstances. Here you can see a list of the most common indications for the procedure, most being related to portal hypertension. However, there are other less common indications as well. Contraindications are primarily associated with patients that are unable to tolerate the increased venous return after stent placement, such as those with congestive heart failure and pulmonary hypertension. Here's a rough outline of the steps that a TIPS procedure will include. After the patient is properly anesthetized and prepped, vascular access is typically obtained via the right internal jugular vein, which provides the most direct approach for the hepatic vein catheterization. The hepatic vein is catheterized, typically the right hepatic vein. A needle is passed through the liver parenchyma into the portal system, typically the right portal vein. The following videos will primarily focus on the steps of tract creation and shunt placement, which are particularly difficult steps in the procedure. There are multiple methods that can be used for this portion of the procedure, such as intracardiac echocardiography, CO2 venography, as well as others. Once the shunt is created, another venogram is performed in order to confirm the placement and patency of the shunt. While this procedure is typically associated with a high success rate, complications can occur, hemorrhage and shunt dysfunction being the most common. Additionally, patients should be monitored and educated on the potential for shunt-related encephalopathy, which can occur after the procedure. Okay, that will conclude the first video of this series. The next videos will focus on the different kits available and additional information on how each kit can be used in different situations, as well as the different techniques each kit allows for.